So yeah, I think, and it's very common. It's like, what is it? 1 in 10 adults don't have full continence from their bowels.
Wow.
So it's a lot. It's a lot of
That's
people.
a
Yeah,
lot.
and most of them are women. Most of those people are women.
Wow.
Yeah.
Wow. This is Eclipse Wellbeing Podcast, and I'm your host, Chimaka. This is where we talk about women's health and we talk about the digital system supporting women's health. Today, I'm speaking to Dr. Mhairi Collie. She is an NHS surgeon, also doing work in sub-Saharan Africa for the past 25 years, treating women injured in childbirth. Dr. Mhairi won the Global Citizenship Award, which recognizes health professionals dedicated to providing care in low and middle income countries. She has also written a fictionalized account of her story published last year titled The Bright Fabric of Life. Let's jump in. Hi, Mhairi. Nice to see you. Thank you so much for joining me today.
It's a pleasure. Thank you very much for inviting me, Jamaica.
Awesome. So for our listeners who probably don't know you, would you give me a quick intro of who you are, both professionally and personally?
Sure. So my name's Mhairi Collie. I'm a surgeon, general surgeon up in Scotland in Edinburgh. I've been here for about 25 years. And I have particular interest in looking after women with health problems. I'm actually a bowel surgeon, but I look after a lot of women's issues within that arena. I also work abroad. I've been going to sub-Saharan Africa for about 25 years as well, a few weeks a year, 6 weeks a year now, to treat women injured in childbirth. And that's a particular sort of passion of mine. And what else? I'm married. I've got 2 kids. I've got a dog. I published a novel last year about a
Yay!
young surgeon.
Congratulations. Yeah.
Yeah, about a surgeon and a fistula patient. Those girls that I treat in Africa have a condition often called fistula, which is terribly debilitating for them. So I wanted to tell
Wow.
their story a bit. So that's my big news from last year.
No, that's great. So we're going to get into the nitty-gritty of, what you
Yeah.
do professionally, but you did mention you're both a surgeon and a writer. How do those two ways of seeing the world inform each other?
Uh, oh, well, I think that's really interesting. They both have an influence in each other, I think, don't they? So
Mm,
I'm quite a reader, so I've always been a very avid reader, and I think in terms of trying to make sense of some of I don't know, the difficult things in life and inequalities and the dramas and the tensions and things, it was quite a natural thing for me to try and express some of that in writing. I did
mm,
actually try to write a memoir quite a
mm.
number of years ago, but I just found it too difficult. You had to be so kind of honest.
Yes.
And
I think that's one of the
um,
hardest ones to write because you're just putting
yeah,
yourself out there completely.
yeah,
Yeah, I don't
yeah.
think
So
I'm
I've
there.
slightly I've hidden a little bit behind the fiction, but writing a lot of my own anecdotes, but in a supposed fictional kind of format, which has been
Yeah,
very good.
no,
And
that's
it certainly
great.
helped me reflect more on the surgery that I do or the work I do in terms of not just seeing it as a very physical, oh, I did this type of operation, I did 24 of them. It's more just to think of it in much more personal terms and the effect that being ill and having treatment and everything has on a person, how it interrupts and interferes with their life so much.
Yeah, no, that's a good point. Was there a moment in your medical training or practice that like pushed you to finally write? Because I can imagine, I think a lot of writers think about it for years before they actually do it. So was there anything in particular that pushed you to actually do it?
Yeah, so I did it particularly. I did a kind of stint for Médecins Sans Frontières during the war in Sri Lanka. That was quite a long time ago.
Hmm.
So it was 2001. And obviously there were lots of difficult things there, landmine injuries, a very difficult population to generations really born in a war enclosed area that they couldn't get out of. So it was very, it had a big effect on me. And I think that certainly I wanted to kind of express some stuff
Hmm.
after that. So I think that's what started me off.
And how did you make out time to write? So do you think medicine leaves enough space for storytelling? Like how did you do it? How did you juggle?
I think so, yeah. I mean, I think any job that's quite full on, you have to make space for the other parts of your brain to survive. You know, it's like a garden. You have to kind of water all the different bits and feed it, and so I think you always have to have some space for personal growth or culture or whatever you want to call it. And otherwise everything else suffers as well. You know, I think you're not such a good, I don't know, doctor or
You need to
teacher
have
or
an
lawyer.
outlet. I see what,
Yeah, yeah,
you kind of need to get lost in a different
yeah.
world to what you live every day.
That's right. Yeah, and
Mm.
and to be able to take a step back from your world and just look at it a bit and look at yourself and reflect and everything and
Yeah.
feed those parts of your brain that are not necessarily stimulated. Um, so I think we're very lucky. We've got such a sort of rich culture with, there's so much going on in terms of music and arts and books and podcasts, and there's tons of ways of keeping all of your soul alive.
You're completely right.
Yeah.
Yeah. All right, great. So let's get into the women's health bit because
Mm,
I really interested in just women's health in general. And this is a part that this is your playing field. This is somewhere that
mm.
you've spent a lot of time in. So from your experience, where do you see women's health most consistently misunderstood or under prioritized?
So I think globally, it's massively under prioritized. I mean, there's still so many, literally thousands and thousands of women that die in childbirth. And it's not a priority for many governments. And I do appreciate in low and middle income countries, they've got a lot of calls on their finances and they've got a limited pot.
Mm.
But it's amazing how far down the priority list obstetric healthcare is. And, so many women die still, and it just doesn't happen in countries that invest in healthcare. So I think that's still, I find it very shocking. The figures are just are horrific. And I don't think there's enough awareness of that.
Mm.
I mean, it's like 3 airplanes a day of young women going down. I mean, if you imagine how we respond in the world if we know a plane has gone down, quite rightly, everybody's upset. But if you imagine three every single day,
Wow.
that's such a lot of
Wow.
young lives. And I think that's the major thing that I find frustrating, that it's not
Mm.
enough of a priority for people. And, I know there's lots of reasons that countries feel they need to have an army, but it's a lot of money goes into having an army.
Yeah. I mean, your analogy with a plane is such a visual way of putting it because I think
Mm.
part of the problem is that it's been normalized in a
Yes.
weird sort of way. And it's nothing not normal about it, you
It's not
know?
normal. No, and it's certainly not normal in this country. I mean,
Mm.
tragically, a number of people do lose their lives in childbirth in this country, but we're talking literally like 1% compared to Uganda, where I go.
Mm. Mm.
So there'll be a 99 women will die for every one here.
Mm.
And that it's all just about resource.
Yeah, that's
Yeah.
really, yeah, this is very sad. So yeah, you mentioned childbirth. Are there other particular moments in a woman's life, whether it's midlife, diagnosis, recovery, where you believe the system tends to fall short?
Yeah, so the all those women in lower middle income countries that don't survive, about half of that number again will have an injury, and these are the things that I go to try and fix. So
Mm.
there's all that happening as well, and those women are they have a terrible time. They're really ostracized and kind of discarded. They're no use anymore. So that's a big priority for me to try and address that issue as best I can. And obviously we don't have that particular injury really happening in the West, in UK, for instance. But we
Mm.
do have a lot of women that I see all the time who have problems with their continence or prolapse or stuff, and there's so much shame around it. That it's not just the physical thing that's wrong; it's the kind of social consequences of that. That people feel, oh, I can't go out the house anymore. I can only go to this shop because I know there's a toilet and they won't give me a hard time if I have to go quickly.
Mm,
It's just so restricting. And I think our own taboos around areas of women's health really affect people, very badly. So I
mm,
think I don't think you get so men being ashamed of having even now having a prostate problem. It's actually quite okay to talk about that,
mm.
but you don't get many women talking about their continence issues.
No, no.
Yeah.
And like you said, I know it definitely does happen even in the UK because I just as you were talking, I remember years back I did work with a lady who, talked openly about her injury during childbirth and
Mm,
how she had such a terrible tear.
mm,
Um, and just kind of years of trying to deal with that surgery and all of the
mm.
impact it's had on
Yeah.
her.
Yeah.
And it just got me thinking, there are cultures that would not even allow people to share that kind of story. And so they
Yeah.
suffer very quietly,
Yeah.
in silence. And that must be horrible. Yeah.
I know, and I think people feel somehow ashamed as if it's their fault. And I
Mm,
think it is often conflated with a bereavement reaction. They've lost their baby.
mm.
So they have to deal with all that as well, and it's very difficult for them to know, well, was it my fault, or why has this happened to me?
Yeah. I think
You
women
know,
carry a lot of guilt, a
yeah,
lot of guilt because it's almost like you said, if it doesn't go exactly as it should,
mm,
for you, then you must have done something to cause
yeah,
that, you
yeah,
know.
yeah. That's
I
right.
remember when I had my first baby and my milk didn't run immediately.
Yeah,
It took a few days, and everyone around me made it seem like such a big deal, like there was something I wasn't doing. Like the nurses, everyone was like, wow, I've never seen this before. I've never seen this before. And as a young first mom, I was just like, oh my gosh, I must be a horrible mom. Like,
yeah,
you
yeah,
know,
yeah.
and
It's
I
very
think it was
hard.
4 days before I saw milk.
Yeah, but
And I
that does
felt so
happen, doesn't
guilty.
it? Yeah, I know, and you feel guilty about ridiculous. I mean, I think you're right. There's some sort of hormonal thing that happens that because I remember my first child was a cesarean, emergency cesarean, and I remember saying to my husband afterwards, I just feel a bit guilty that I didn't, have a normal delivery, and I feel like I should have done. And he was like, "What are you talking about? Our son would have
Yeah.
been dead."
How is that? How
Yeah,
is that in
I know
any
that,
way?
but you still feel it. It's kind
Yeah.
of strange. Yeah, there's a lot of weird hormones of what they do to us.
So in your medical field, how often do you see women doubting their own bodily knowledge and where do you think that comes from, like from your experience so far?
Yeah, I see it all the time. I mean, it's partly because it's a bit of one of my areas to look
Mm,
after people who have continence problems. But no, I think we bring up our children, we toilet train them and teach them, and so they feel if they have an accident that they're naughty.
mm.
And it's difficult to shift that. You know, people are expecting their mums to come and give them a row.
Yeah.
Um, yeah. So yeah, I think, and it's very common. It's like what is it? 1 in 10 adults don't have full continence from their bowels.
Wow.
So it's a lot. It's a lot of
That's
people.
a
Yeah,
lot.
and most of them are women. Most of those people are women.
Wow.
Yeah.
Wow.
Mm.
So as a
Yeah.
surgeon,
So it's a
how do
very
you?
hidden problem, I think. Yeah.
Yeah, yeah. Okay. Now that's really interesting. So as a surgeon, how do you navigate the tension between clinical authority and a patient's intuition? That's something I've always kind of wondered.
Say again, the between clinical authority and
Yeah, and a patient's intuition. So, because I think I've heard of scenarios where, and it might not be particularly in your own case because I think your case is quite visual and it's kind of really clear what the problem might be with a woman. But I've definitely heard of instances where a patient or a woman might not feel quite well in herself or might be saying something, but you know,
Mm.
she's examined and she's being told, no, you're fine. Um, yeah, and there's always that question of, oh, a woman knows her body,
Yeah.
physicians maybe need to listen a little bit more. Yeah,
I
how
think
do
that's
you?
right. I mean, I think you have to listen. Uh, I think one of the things that's difficult is that we're often talking about the patients are talking about function. They're talking about, I can't hold it if I need to go to the loo. It just comes, or I have less than a minute. So they're very much talking about function, and we're very often talking about an anatomy. You don't have a big enough, you've got a tear in your sphincter, or you've got a prolapse that you can't hold. So we're looking for an anatomical explanation
Yeah.
for a functional problem, but that doesn't always marry up. And so sometimes we're answering one question saying, oh, well, actually, you don't have a prolapse, you don't have a sphincter injury, but that doesn't mean that it's all working properly.
Mm.
And it's being able to find solutions for people in that middle ground, where you've not found something that you can literally stitch back together again, but nevertheless they still have their functional problems. So what can you do
Mm.
to help them with that? So I think we're kind of coming in different at it from different directions, but there should be a middle ground that we
Yes.
find. But that is what it's all about, isn't it? The talking and listening and trying to understand each other's perspective.
That's right. That's right. If I come back a little bit to your writing, because I think, that was a big achievement last year and definitely not, not an easy thing to pull off. What does writing allow you to say that medicine doesn't? Yeah.
So yeah, I think it's a really interesting thing to think about empathy and sympathy. Yeah.
Mm.
So when we're like treating somebody, we've got sympathy for them and we want to show them sympathy, but empathy requires you to sort of almost see it from their perspective. And I think that's more difficult to do in your role. You're trying to be empathetic, but at the same time, you're really trying to offer solutions.
That's right.
And
That's right.
yeah,
That must be hard to harder than a lot of people imagine to balance because you're almost
yeah,
holding yourself back from being too clinical and functioning as a doctor and just
yeah,
kind of remembering your human side as well.
yeah,
Yeah.
yeah, that's right. So that is, and sometimes, you, you are there to be the patient's doctor. You're not there to be their friend. They've got friends and family, and you're kind of overstepping the mark a bit to sort of go into that. This is your role. So I think the writing was really nice as a sort of just a release of some of that built up emotional tension, way of being able to imagine the patient and give her dialogue that sort of that shows that I do understand how terrible it is and how what people are going through.
Mm.
So that was really nice for me to kind of for once be talking from the point of view of the patient instead of the surgeon. And then the other thing that was really nice was to try and show people a little bit what it's like to be the surgeon, to be the other side, to be slightly floored with anxiety from morning till night, worrying about your patients and worrying
Yeah.
that you've done the wrong thing or the right thing and will they be okay? And there's I think people don't always realize
Mm.
the that side of things, because
Yeah.
you can't really whine that you're feeling worried when the patients are going through so much more than you are.
Oh
Um,
gosh, yeah, that's right.
but actually, we do. There's a lot of anxiety and stress and worry that we feel.
Yeah. Of
So it's quite
course, of
nice to be able
course.
to
Yes.
see.
I
So
mean,
it was a good release. The book was a good release for all these
yes.
things.
I can imagine. I can imagine. Trying to find your peace, with, whilst doing it. And I think especially, how do you, I think especially for some of the women that you help, how are you able to sort of separate that vulnerability you know, that you might, because, you see a lot of people in actual pain and discomfort and in their most vulnerable state. So how do you hold vulnerability, your own and others, um, as you help them, as well as responsibly on the page?
Yeah, I mean, I think you have to put your own emotional needs to the side,
Mm,
definitely, and try and be very focused on the patient. And the good thing is that we're not just observers; we are actually able to offer succor and help, and uh, we can actually make people feel better and be better. So there's a lovely sort of reward cycle in that you can feel very satisfied that you have helped. But there's, the flip side of that coin is that there will be some people that you haven't managed to help, for all your best efforts. So
mm.
yeah, I think there's always lots of good things that can make you feel better about your efforts. But we don't let go of the ones that where it's not worked or something's gone wrong. So
Yes,
you have to have
absolutely.
both.
I remember speaking to a friend and saying how, if I had gone down the medicine route, I probably would have loved to be, a pediatrician and just
Ah.
helping children. And then she made a good point, and she said, but it just also means that when it's a bad news,
Mhm.
it's,
Yeah,
it's a
I
bad news
know.
about a child. And that just kind of hit me because sometimes you're just thinking about it from a positive point of view, the helping part.
Yeah, yeah.
And some of those other cases that you quite didn't manage to save can just be absolutely heartbreaking. And so it's so important to try and separate yourself from that sometimes as much as you can. But I can imagine as humans, it's not always going to be the case. All right. So
Um,
thanks so much. About that, if I kind of move a little bit closer to the digital part of things, because as you can imagine,
oh
that's
yeah.
also a part of my interest. We're seeing a rise in digital health tools, and tools aimed at
Mhm.
women. What excites you and what worries you about this?
So there's quite a few really interesting sort of ventures going on in Africa, using AI, and sometimes some using sort of Fitbit technology so that you can make an assessment of somebody, and more quickly send them up to somebody that needs to see them, if you like. So what we call triage.
Mm,
So I think there's lots of potential use of AI and of technology for people who are very rural or who don't have access to an all singing, all dancing hospital just down the road. To try and figure out who actually needs help and how do you work that out quickly enough that they get it, even if they have to travel a bit. So I think it is a good thing that.
yeah.
Um,
Mm,
in our country, I think personally it's difficult, isn't it? There's information is good. I'm all for empowering people and educating them,
mm,
but it's difficult to make sure that the information that they access is accurate and is actually relevant to them.
mm,
So a good example of that is like at the moment, there's lots of disinformation about the side effects of contraception,
mm,
all around the internet, such that a lot of young people don't use contraception and the
mm,
abortion rate has gone way up.
mm, mm,
So that's a very clear consequence of people being concerned about potential of side effects or effects of taking contraception. So they don't take it, but then they have an abortion.
mm.
That's and whatever your views are on whether people should have access to contraception or should have access to abortion, that's definitely a thing that's happened that's been fed by what is a lot of the time is actually misinformation is a bit like Trump saying that you shouldn't take paracetamol if you're pregnant. There's no truth in that. There's
Mm,
no science behind that, but nevertheless, it's out there, and so
yeah.
but some people pay attention to that. So
Mm.
yeah, I think it's difficult to know how to fight against that.
That's a good point. Yeah, I think that's a difficult one because even before AI, there was the internet,
Mm,
I think AI has always been here, to be honest. There's always
yeah,
been levels of automation in AI, but I think it's much more widely known now. But yeah, it's the misinformation, it's the cultural and religious beliefs that,
yeah.
could be spread as well.
And I think it's quite hard to get good information. Like say, in the old days, you would maybe make an appointment to go and see your doctor, but it's quite hard to do that.
Hmm,
It's not that easy, where it's very easy to just click a few things on your phone.
that's
So
right.
I slightly feel that we're not necessarily providing good information so accessibly.
Hmm, hmm,
And I think people are trying. So, for instance, there's the NHS Inform websites, which are, getting better and better and trying to really give people good information. So there are more reliable sources on the internet, and although I don't know if AI would pick them up preferentially, I suspect not. Um, and there's a few other ventures that we're trying to run a festival called Every Woman Fest,
hmm,
which is run a few times in Cardiff, and we're doing one in Edinburgh. There's going to be one in London this year as well, which is a little bit feels like doctors and health workers coming out of their safe space to just engage with the public in a much more neutral festival type atmosphere.
yes.
So, which is really interesting to me of just the kind of trying to break down those barriers
Hmm.
of communication.
You make a really good point because I think that might help people just not being in front of a doctor in a doctor's office, that's intimidating enough and kind of feel
Yeah,
like you're being interrogated or just kind of you have to let your guards down. But in that kind of atmosphere, everyone's there because they are interested in those topics. Everyone's there because
yeah,
they want to listen and be listened to. And so maybe it's a kind of environment to share some of those information and really get people
mm,
asking questions,
yeah.
yeah, that on their minds. Yeah.
Yeah, yeah, dialogue is interesting, isn't it? Because, I think the medical profession has been very paternalistic and has probably not encouraged dialogue.
Hmm.
And, if you're short of time, you don't, it's not, you might like to sit and have a coffee with your patient and chat over all the ins and outs of contraception, but you might have a 5-minute appointment
Hmm.
and there's a waiting list room of people trying to see you about other things. And
Exactly. It kind of can feel
yeah,
rushed, I'm sure I know I've definitely had,
yeah,
people say it just feels rushed, yeah, sometimes.
yeah.
And yeah,
Mm.
I think everyone's trying to do the best that they can. But yeah, I think those kind of fests, yeah, that's a really good one, actually. So what do you or rather, where do you think digital technology risks maybe oversimplifying complex health experiences? Are there like maybe examples that you can give?
Yeah, I think so because people are individuals and they have their own. So, for instance, if I'm trying to work out what's going on with somebody's bowel function, yeah,
Mm,
I need to know about their diet. I need to know about their medications. I need to know how many children they've had, if they've had other operations, if there's stuff in the family. I need to make an assessment of their body habitat. Yeah, there's so many different factors.
mm,
And yet, if you just look up, I don't know, incontinence or something, you might just get a very straight down, right, this is the average, but none of us are the average. We're all got our own kind of history.
mm.
So I think you're always going to get a bit of simplification. It's trying to adapt it to the individual, isn't it?
Yeah, yeah, that's a really good point. And how important is trust? So, for people using some of those digital tools, like in terms of data, design, language, when women engage with digital health platforms, because one thing that I've noticed as part of my research is that sometimes the systems are built as if knowledge, as if data is neutral, but just like you've just said, not everyone is always represented in the data that the systems use. And
Mm.
there's been findings that, for instance, for a black female, that there's very little or no data used um, for them in the systems. And so there might be systems that are developed with just a particular group of people in mind, but it's available to everyone. So yeah, how important do you kind of think that is from a health system point of view?
Yes, that's really interesting, isn't it? I mean, I think when you're seeing a patient in clinic, they are an individual to you. So you are sort of seeing them face to face and there's that. But most drugs are probably not tested on that type of patient, their race, their age, their gender often. Surgical techniques and instruments are generally they're one size fits all.
Mm.
You don't get a different sized stitch or knife or
Yeah,
needle or
that's right.
just like cars. Cars are all tested for 70-kilogram men. I think, seat belts and airbags and things like that. There's so much equipment that is just made for that one person. And so, yeah, I think it does kind of spill into all sorts of other areas as well. I, I think there's a bit of an inherent trust that we all have, don't we, of medicine. Like I would give
Mm.
you an antibiotic and expect it to have the same effect on another patient who's totally different ethnicity, gender, age, uh, and I would expect the effects to be the same, but they're probably not the same. So I
Yeah.
guess that we all trust that there'll be enough of an overlap that it doesn't matter. But I think there will be areas where it does matter,
Mm.
where people really don't react the same, because of factors that we've not really brought into it.
No,
Yeah, I don't know
that's
how to fix that though, really, apart from maybe to have an open mind to the fact that, somebody, if you try something for somebody and it doesn't work, it's unlikely to be their fault. It may just be that the treatment is not appropriate for them, doesn't suit them.
mm. Mm.
Yeah. I mean, what do you think as a kind of user
Mm.
of the health service? Do you feel you're kind of trying to fit yourself into an average mold?
Mm. Yeah, I mean, that's a really good question. And from a personal experience, I have to say that I haven't necessarily felt that or experienced it particularly, but I've definitely had stories
Mm,
um, of women who have
hmm
uh, felt like, but I think it's less the treatment, but the experience, the general
hmm
experience of being in the
hmm
healthcare. Um, but yeah, and I think that from a digital point of view, it's just the fact that there's a lot of research showing that there's a gap in systems because of the data, the gap in the data that is used for these systems. Because essentially AI is a tool that will do what it's asked to do, that will, use the data that is available to it. And so if we don't go out of our way to make sure that we are including everyone in the data, then essentially we just do what you ask it to do and provide information to everyone as if they're the same, as opposed to taking
Yeah,
into
that's right.
consideration, yeah, those
And you
differences.
wonder, I think that's really right. And you wonder where they've got the data from. I mean, I'm pretty sure that the NHS data has been sold to a lot of insurance companies, health
Mm.
insurance companies. So I'm sure that there's data available from the NHS. I know that I think Iceland sold all their genetic, didn't they? Didn't they genetically profile the whole population?
Yes, that's right.
Uh,
That's right. Yes.
But that's a very specific, I mean, like, for instance, I think they've traced all the breast cancers in Iceland to one guy who had a genetic mutation, and everybody who's had breast cancer is related to that one guy from X generations back. So that's a very
Wow.
tiny population with not
Yes.
much influence from outside. So that's
Yes.
going to be very different to people with breast cancer that are not, there's nothing to do with that genetic
That's
mutation.
very interesting. Yeah.
Yeah.
That's amazing. Yeah. I mean, it's funny about genetics, right? And just so how complex it can be,
Yeah.
and how widespread, its impact can be.
Mhm.
Yeah, so that's a very interesting example. I haven't heard that story.
Yeah. I mean, I
Yeah.
wonder how we fix it. Do we try and make sure that health systems around the world have to put all their data into a big pool? But then, is that
Yeah, that's a
acceptable
good
or
one.
not?
I think unfortunately the world is not a very friendly place. People don't play, play
Mm.
partners, as partners and everything. We've seen a lot of
Mm.
changes that happen even this year with tariffs and taxes, etc. And
Yeah.
so I think it will be very difficult to get different countries to share their data. But
Yeah.
I think there's a lot of sharing happening anyway, whether we like it or not, as users. Once
Yeah.
you put your information somewhere, it's being shared anyway, because otherwise, how can you account for searching for one thing somewhere, and then the next time you log into a different, device, you have a lot of adverts. In
Yeah.
fact, a colleague of mine said to me, because we were talking about user profiling and just how easily it is
Mm.
for your information to be out there and to be used by all kinds of companies. And he was telling me that his wife was standing in the kitchen and thought about something. I mean, she didn't put it on any device. She didn't even say out loud, because I think with everyone having Alexa in their houses
Yeah.
now, there's a strong belief that you might, you're having a conversation. We know it's being recorded. I mean, that's not even like a guess.
Yeah.
So a lot of people are freaked out about it. I know my husband always turns it off on the wall. Um, so, it picks up your words, and then it kind of
Yeah.
puts things in front of you to buy and marketing things. And a colleague of mine said that his wife just thought about something. And then next time she was on her laptop, she saw, those items being
Yes.
marketed to her. And I
That's
thought, okay, that's
crazy.
crazy. Just the thought of that. And we might get to a point where just thinking about it is enough for
Yeah.
you to be
Do you know what
profiled.
would be, well, that's right. I think what we should do, though, as a population is try and work out a role for AI that is not just about marketing and advertising. Nearly all of it seems to be about what can we sell this person.
Mm,
And there's a bit about profiling people for votes, for manipulating them for elections.
mm,
And then there's a lot about porn. And I'm not sure that AI, I'm surely we can find something more to do with it than sell people's stuff.
yeah, yeah,
It'd be really nice to kind of really, and if people are, talking about things, to use that in a way that actually gives them maybe some, I don't know, some health advice
yeah,
rather than just, do you want a holiday? You
yes,
know,
something much more positive. And I'm
yeah,
sure there are things happening in the background. I think the challenge is the fact that it costs money to do that, right? And the people
yeah,
willing to cough
yeah,
out that money are the people who are looking at the profit and things to be gained from it.
yeah,
Um, but
yeah.
the hope is that if the government starts to support some ideas, then it will be less about profit and more about helping
Mm.
people. But it's just how far away we
Yeah.
are, from that.
Mm.
And
Mm.
that kind of brings me to maybe just kind of trying to breach, like, you were just talking about tools and how we can help people, and just kind of starting to bring peer support and collective care into the view, how powerful do you think it is for women to have a system that gives them a pair connection? You know, is that something you think should play a bigger role in healthcare along clinical care? So, for instance, if a woman was going
Yeah, I
through
do.
a particular experience, because apart from just kind of getting that clinical care from the doctors, there must be like I'm wondering if you think it's a good idea, that it might help a woman's mental state and well-being to just have a pair connection and support of people going through the same things. Mm.
I think that's really right. I mean, one of the things that we definitely notice when we do some of the work in Africa, we sort of run it as a kind of camp. So we bring a load of patients together in one place that
Mm.
would not have known each other, and they definitely benefit from that. You know, you can see them initially very withdrawn and kind of heads down and quite depressed and have been very isolated socially. And then by a few days in, everybody's chatting and there's just a totally different atmosphere and
Mm.
a lot of hope is returning and people are feeling very encouraged and encouraging each
Yeah.
other. So yeah,
Because
I
it's,
think it's
it's a
really
terrible thing to
important.
feel alone, isn't it? To feel
Yeah,
that you're in it alone and just knowing that there are other people in the same situation and being able to share that, your ups
yeah.
and downs with them,
Mm.
I can imagine plays a big role, in supporting
Yeah,
the recovery process.
yeah. I think that's right. Yeah. I think the thing that's always difficult is that it's a bit like Um, the people who post the most and who want to be on some of these, like a patient support group, they're more likely to be on there because they're having a problem.
Mm.
So it's always skewed a bit more to when things are not going so well, which is maybe because that's who needs it, but it also can give slightly the wrong impression to people that, oh my God, everybody who has this treatment is having a nightmare.
Mm.
Whereas it might only be 5%, but they're all in the chat group because they're needing the help. Whereas the other ones who are fine are not interested.
Yes.
So it's trying to get to keep it that people are not dragged down, that they actually are lifted up a bit by it rather than.
That's right. That's right. And my final question, what's one thing you'd want every woman to feel more confident about when it comes to her health?
Let me think. Like every woman in the world.
Well, that's a difficult one, isn't it? Right? Yeah, you can break it down. Yeah.
I would probably well, like I look at the young girls,
Mm.
my daughter is just a teenager, and I look at them, and I would like them all to feel that they could go through that process of having a baby without
Mm.
the fear of something really terrible happening. And I think that would be my wish. Yeah.
Oh, that's a beautiful one because, I think it's one that plays on every girl's mind. Because I remember even when I was a young teenager, it just kind of always played on my mind. And sometimes, when I'm constipated, for instance, and then I'm saying to myself, oh my God, it's gonna be even harder than this without the realization that they're
Yes.
two different processes, they're two different things,
Yeah.
right? But even
Yeah.
then, I'm just like already worked up and thinking if it's hard to just
Yes.
go, how harder? It must be a lot harder to have
Yeah.
a baby come out of you. So these are, but it's all down to, more education as well. And yeah, and just reassurance, and making sure that we've got enough skilled workers, as well as the tools to help them do their job so that the patients can have better care across the world. Wouldn't that be ideal?
Yeah, I know because there will be some girls who literally are not going to have any help. You know, they know they're going to have to do it themselves. And, you know, that must be just terrifying.
Yeah.
Yeah.
Awesome. Thank you so much. That was so interesting. Yeah.
Good.
Thank you for making out time, you know, and being part of this. I know it couldn't have been easy. I really appreciate it. And it was just a beautiful conversation, and I hope you enjoyed it as much as I did.
I did.